What does a total hip replacement look like? Hello, my name is Dr. Dan Albright. I'm an orthopedic surgeon in Raleigh, North Carolina. I specialize in hip and knee replacement operations and started in practice in 1994. I'd like to just go over first a normal hip. What is a hip? A hip is a ball and socket joint. Here you have the femoral head, the ball. And here's the socket, the bony socket called the acetabulum. And the ball fits in the socket. And it's a beautiful system when the cartilage is smooth. And so what does a total hip replacement look like? Well, ideally, we mimic nature with an artificial joint replacement. So here's an example of a ball and socket that's artificial. You have a round ball, sometimes it's metal, sometimes it's ceramic, and then you have a socket called an acetabular prosthesis, which can be made out of different materials, and then a stem. And I've got other examples here to show you, because I have a number of patients who want to know, doctor, what's going to go in me? What's going to be in my hip? What's it made out of? And so this is an example of an older model, femoral stem that was fitted into the femur. And in the old days, we cemented a lot of people, and cement is still used in some patients. But more and more, I and many surgeons have moved away from cement towards porous coating. Porous coating, this is a titanium stem. Most femoral stems are made out of titanium, cobalt chrome. There's porous coating or a sandpaper material on here. And over 6 weeks after this stem goes in your femur, the femur is a tube. It's hollow, and we put this inside the tube, the femoral bone. The bone grows into the metal. So it biologically interlocks with the metal, and it becomes, a great solid system over 6 weeks. So that's the stem. And then you have a head. This is a ceramic head. This is my favorite. The ceramic is harder and smoother, and I use ceramic on pretty much everybody. Some surgeons still preferentially will use a metal ball. It may not matter, but ceramic is my material of choice. And that goes on to the top of the stem. And right at the end of surgery, I can put an extra short ball on, a short, medium, long ball, extra long. That's part of the art science of a hip replacement. You play around with the leg lengths to get everything, all the tensions properly done. So that's the top of the stem with the ball. This is the socket. Titanium, typically porous coated with sandpaper. And usually we put a plastic liner, pretty much almost always, that snaps into the socket, and then the ball, I'll show you over here, goes into the plastic. So it's a really good system, and we're reproducing nature in many ways, the plastic being the cartilage. And then lastly, for more complicated hips, we may use a longer stem that's modular, different pieces. This is porous coating also. This would go almost all the way down to the knee. And this is another example of modularity. So you can dial in and customize the hip depending on what your anatomy looks like. So a lot of options, and the technology has really been over the decades. So if you want to know more about the technology or hip replacements, I'm happy to see you. My website is danalbrightmd.com. And for appointments, phone number 919-863-6808. Thanks.